rare infectious disease, has seen over a 50% rise in the U.S. recently, affecting children, older men, and indigenous groups. Spread by bacteria from ticks, deer flies, and infected animals, it presents symptoms like skin ulcers, eye irritation, and respiratory issues. Prevention includes using repellents and drinking safe water. Tularemia, also commonly known as rabbit fever, has witnessed more than 50% rise in the U.S. in recent years, as per a recent report. A rare and sometimes deadly infectious disease is seen in children between the 5–9 years age group, older men, and American Indians or Alaska Natives. The bacteria has been designated a Tier 1 select agent, or the highest risk category, based on its potential for use as a bioweapon.
Tularemia is caused by the bacterium Francisella tularensis and can infect animals and people. Rabbits, hares, and rodents are more likely to get the disease. People can also become infected in many ways, including tick and deer fly bites, and contact with infected animals like rabbits, rodents, and hares. The infection can also spread by drinking contaminated water and inhaling contaminated aerosols or agricultural and landscaping dust, and laboratory exposure, as per CDC. Between 2011 and 2022, the annual average incidence of tularemia infections rose by 56% compared to the previous decade, 2001 to 2010, according to the Centers for Disease Control and Prevention, CDC. A report in the Morbidity and Mortality Weekly Report indicated that over 2,400 cases were recorded during this more recent period. Although 47 states reported cases, the majority of infections came from just 4, Arkansas, Kansas, Missouri, and Oklahoma, which together accounted for roughly half of the total. The significant rise in cases could be partly due to better reporting of probable infections. The authors of the report suggested that the increase might reflect either a real surge in human infections or enhanced detection capabilities, particularly with advancements in commercially available laboratory tests. Signs and symptoms of tularemia, rabbit fever. Tularemia, also known as rabbit fever, can range from mild to severe, with fever being a common symptom across all forms of the illness. The symptoms vary depending on how the bacteria enters the body. Below are some of the key signs and symptoms mentioned by the CDC. 1. Skin ulcer. The most frequent symptom occurs after a bite from an infected tick or deer fly, or handling an infected animal. A skin ulcer appears at the site where the bacteria entered the body, typically accompanied by swollen lymph nodes in the nearby area, often the armpit or groin. This form is called ulceroglandular tularemia. When there is no ulcer, the condition is referred to as glandular tularemia. 2. Irritation and inflammation in the eyes. When the bacteria enter through the eye, a condition, called oculoglandular tularemia, can develop. This often occurs during activities such as butchering an infected animal or touching the eyes with contaminated hands. Symptoms include eye irritation, inflammation, swelling of lymph nodes in front of the ear. 3. Sore throat and mouth ulcers. Tularemia can also spread through ingestion of contaminated food or water. Individuals with oropharyngeal tularemia may experience sore throat, mouth ulcers, tonsillitis, swelling of lymph nodes in the neck. 4. Difficulty breathing. The most severe form of tularemia affects the lungs, leading to symptoms such as cough, chest pain, difficulty breathing. This can occur after inhaling dust or aerosols containing the bacteria. It can also happen when other forms of tularemia are left untreated, allowing the bacteria to spread through the bloodstream to the lungs. How to prevent tularemia? To reduce the risk of contracting tularemia, consider the following preventive measures. Use insect repellents to prevent tick and insect bites. Wear protective clothing such as long sleeves and pants to keep ticks and deer flies away. Remove ticks promptly using fine-tipped tweezers to prevent infection. Avoid drinking untreated surface water that may be contaminated. Wear masks while mowing or performing activities that may disturb dust or aerosols containing the bacteria. Use gloves when handling animals like rabbits, muskrats, prairie dogs, or other rodents, which may carry the bacteria. Cook game meat thoroughly to kill any potential bacteria. Currently, there is no vaccine for tularemia available in the U.S., but the illness is treatable with antibiotics. The case fatality rate is usually less than 2%, though it can rise as high as 24% in severe cases. By following these preventive steps and being aware of the symptoms, the risks of tularemia can be minimized.